Well, we can now talk to Ingrid Daniels. She is the CEO and President of the World Federation of Mental Health, an international group working for better awareness and resources, and she joins us live from Cape Town. Thank you very much, Ingrid, for taking time to talk to us. Can I ask you then, what do we know about how COVID-19 has impacted mental wellness?
Good evening, Hannah, and all the viewers. We know for sure that COVID-19 has left its negative tentacles and we've seen significant mental health consequences as a result of the virus left on people really battling to cope. We've seen increase in anxiety, depression, and just fear about the uncertainty that prevails at the moment.
Now, Ingrid, you said last year that a suicide is reported every 40 seconds across the world. What do you think the situation is like there now?
We know that it has increased, Hannah, and we are very concerned because we know that the second lead cause of death amongst our young people, 15 to 29 years old, is actually suicide. So we are extremely concerned, and we know, as we've seen the trajectory of the COVID-19 virus impact on mental health, we've also seen the increase in suicide during these very difficult times.
Now, what kind of solutions currently exist? Are they policy-based or community-based?
Well, we're calling for mass-scale investment in mental health. So our theme for World Mental Health Day is very clear. It's mental health for all, greater investment, greater access. We are calling for policies around COVID-19 interventions that includes mental health as part of the emergency health response. We are asking for budgets to be reviewed. We know on average only 2% of health budgets are spent on mental health. We are also calling for increased interventions and investment in community-based mental health programs, particularly during these very difficult times. And these models of intervention will have to become hybrid models because we see the daily increase in infections across Europe. And so face-to-face interventions have become difficult and not always accessible for people during these difficult lockdown times. So we're asking for increase in remote mental health interventions that can cross borders and reach people within their homes. Yeah. So really an upscaling in mental health at community level as well.
Can I ask you then, given that the pandemic has been going on now for so many months, what then, in your experience, are the best solutions or treatment for mental health sufferers?
Well, I think the most important is that we are able to develop remote mental health services. All you need is a basic telephone in order to speak to people, to reach out to people. A contact is important. The one thing that the hard lockdown has done is that it has isolated people, which meant that people have had limited support during these times. So we're looking at remote interventions that we can reach people in their homes. And sometimes it's a friend that you call, sometimes it's a counselor, sometimes it's your priest or your imam. You know, so we're calling for interventions that can really support people during these times, and be that a phone call, be that a remote activation on a phone. We've done it in South Africa and it's been extremely successful, and we've managed to keep people at home in the community without having to have relapses and rehospitalization during these difficult times.
Ingrid Daniels talked to us there from Cape Town. Thank you very much.